Next item is presentation related to addressing homelessness through the establishment for safer outdoor space. I'll ask Sarah Renner from the City Audit Office for that presentation. Welcome.
Thank you, Chair Osman, council members. On May 14th, this committee directed the Policy and Research Division to conduct a landscape analysis of municipalities with safe outdoor spaces and also identify changes that may be necessary to enable safe outdoor spaces here in Minneapolis. The landscape analysis was presented to this committee on July 23rd, and today I'm presenting the findings of the second part of this report, focused on what has been done and could be done here in Minneapolis to establish safe outdoor spaces. So first, some background, status of homelessness here in Hennepin County. According to the official HUD Coordinated Point in Time count, or PIT count, the number of persons experiencing homelessness in Hennepin County has increased by 24% from 2022 to 2023. This increase was driven in part by a significant rise in the number of families experiencing homelessness. In 2023, both the Pitt and Wilder Foundation counts found a small decrease in the number of persons experiencing unsheltered homelessness. According to both counts, the number of unsheltered persons in Hennepin County more than doubled between 2015 and 2018. And the number of persons living unsheltered has remained at this higher level since that increase. Nearly 86% of Hennepin's total homeless population are in shelters, and compared with other major cities, that's a relatively high proportion. Between 2021 and 2023, Hennepin County's chronically homeless population has declined by nearly 36%. It's now at 315 persons, and reducing this population has been the county's focus. Who's experiencing homelessness? As a part of its homelessness study, the Wilder Foundation interviewed in October 2023 almost 700 adults living in shelters and 585 persons experiencing homelessness in non-shelter locations in Hennepin County. The results of this very robust study paint a picture of who's experiencing homelessness in Hennepin. Just a few, I'm just going to read a few of the stats. 85% of those experiencing homelessness identify as Native American or person of color. 48% report having a chronic health condition. And of those who spent the last at least 15 of the last 30 days unsheltered, outside of a shelter, 77% report a serious or chronic disability, 52% report having been turned away from a shelter, 47% report chemical dependency. So I spoke with a range of homeless service providers about their work as well as the proposal for a safe outdoor space in Minneapolis. The Minneapolis's own provider, the homeless response team, is composed of 2 to 4 persons within regulatory services, and they respond to homelessness-related complaints on 311 and elsewhere, and they track encampments across the city. Through referrals, they connect unsheltered people to needed services. In the last 2 years, they've engaged well over 4,000 people living in encampments. And the observations from staff included there have been a growing number of larger encampments in South Minneapolis, and staff more frequently encounter squatters, people living in vehicles in the near north area. I also spoke with colleagues at Agate, Avivo Simpson, and the American Indian Community Development Corporation. All pointed to a surge in substance use disorder, this reflecting the opioid epidemic. Regarding safe outdoor spaces, all noted the importance of early engagement with service providers and people experiencing homelessness. Outreach staff at Agate noted the difficulty of reaching people who live in cars, given their extreme mobility. They noted the importance, therefore, of the potential importance of safe parking spaces and mentioned the potential for amnesty from parking regulations to prevent cars serving as dwellings from being towed. Colleagues at Agate and Avivo noted the importance of location and community to a subpopulation who live in encampments, and thus their resulting reluctance to travel to shelters. I spoke with the Hennepin County Office to End Homelessness to examine shelter capacity. As of mid-April of this year, Hennepin County contracted shelters for single adults was at 92% of capacity, the space for youth at 86% capacity, and for families it was at 261% capacity. And this is because the county guarantees shelters for all families, and so once existing capacity is exhausted, they procure additional space and staff. 4 months of adult shelter data revealed that most days and nights there was space available, with some exceptions, for single adults experiencing homelessness. In 2023, adults were turned away from shelters 4,000 times, either because everything was booked or because the person had a past rule violation. In 2022, 7,000 adults were turned away from shelters. The county credits this decrease in turning people away to their investment in case management. From 2021 to 2023, the number of people leaving homelessness and finding permanent housing increased in the county by 57%, and that has freed shelter beds. The demand for family shelter has increased the county's spending considerably. Since the pandemic, the county's spending on homelessness grew from about $15 million a year to $50 million a year. Federal ARPA funds covered a large part of the increase, and the expiration of those funds in 2025 puts the existing shelter system at risk. The county estimates that about $12 million in funding is needed to maintain Avivo Village and Homeward Bound shelters, 24/7 shelter services, and case management. So Minneapolis has had experience with a safe outdoor space in the form of the Heading Home Navigation Center in 2018-2019. In 2018, the city committed to housing those at the encampment on Franklin and Hiawatha. The numbers subsequently swelled, making it one of the largest encampments in the country. The city responded by leasing land from Red Lake Nation, 2 blocks from the encampment. Sprung structures were established, providing congregate shelter for what ended up being around 175 people. The city provided at that time for insurance and liability coverage. Restroom, showers, cafeteria, meetings were provided in heated trailers. Simpson Housing Services led the Navigation Center operations, working with the city, county, and a whole range of agencies. And Simpson noted that some issues arose around finding space for people's belongings. There were initial security concerns, and Simpson staff noted a kind of a chaotic atmosphere. 25 clients were exited from the Navigation Center for violating the code of conduct, and after this, Simpson explained that operations began working more smoothly. Staff to guest ratio at this point was high and continued to increase to about 1 in 20. Compared with running a traditional shelter, Simpson staff noted the need to deal with to a greater extent with people's trauma in this setting. The total cost for startup and operation of the center for 6 months was $3 million. The initiative resulted in 100 clients moving into permanent housing. Those rehoused had a slightly lower success rate, but 80% success rate still in terms of staying in their homes compared to the normal 90%. Avivo Village opened in 2020 specifically to provide an alternative to those living in encampments. It has a closed referral process whereby it works with outreach teams and providers to identify those living unsheltered who are not using the traditional shelter system. Avivo has private lockable dwellings for 100 guests. It takes a harm reduction approach that includes on-site, safer, and managed drug use. Approximately 40% of Avivo's 555 clients have been placed in permanent housings. Clients stay an average of 100 days. There are wide reports of a large demand for Avivo-style shelter, but there's no central waiting list, so I wasn't able to verify that. To make safe outdoor spaces legal in Minneapolis would require amending the city's maintenance code to allow for a licensed exception. City parking rules may also be amended to allow sleeping in vehicles in safe outdoor spaces. The intentional community and cluster development ordinance in the city's that's existing in the city's zoning code allows for a land use that's akin to safe outdoor spaces. Intentional community cluster developments are operated by a nonprofit, government, or healthcare agency. Under the ordinance, tiny homes or prefabricated structures can be used for dwelling units and separate shared spaces for bathroom and kitchen needs. The ordinance could be amended to account for anticipated limitations and risks posed specifically by safe outdoor spaces, or the city may wish to create a new ordinance. Depending on what type of structure would be allowed in safe outdoor spaces, the city would need to ensure compliance with state fire, building, and residential codes. If the city decides to move forward with safe outdoor spaces, the report suggests a range of considerations based on other cities' examples. Experience suggests the importance of having a shared and clear sense of purpose from the outset. To this end, thought might be given to whether the purpose is A, to improve the immediate conditions and prospects of people experiencing homelessness, which is the case for the Navigation Center, or if it is to create a sort of longer-term community that helps people experiencing homelessness to transition back to society. And that's more the Avivo example, as well as a lot of the spaces researched in my first report. A space where people stay for a longer period of time, like 100 days, might need more substantial dwellings, like tiny houses and more sophisticated arrangements for running water and waste management. A space modeled as a transitional step, however, might have less substantial dwellings, but would require greater investment in service delivery, including a higher ratio of caseworkers to get residents into housing. The scope of any safe outdoor space can be defined by considering the target audience. Safe outdoor spaces might narrowly target a subpopulation of those living inside of encampments for whom the existing shelter is not an option. Or safe outdoor spaces might alternatively be conceived as a way to expand existing low barrier harm reduction shelter more broadly. So collaboration with the county is another key component. Hennepin County Office of Housing Stability contracts with almost all of the shelter providers in Minneapolis. They set requirements and undertake performance management, monitoring, and oversight. The county also works to connect people in shelter with services, and they manage the Shelter Connect services. Other cities' research for this report have established some sort of collaborative arrangements with the county to manage and operate safe outdoor spaces. A clear division of labor in Portland, for example, enabled the city to establish within the city a team of about 5 people who help manage and operate Portland's villages. They have 6 villages serving around 1,000 people. The division of labor in Portland is based on existing capacity and expertise. So the city identifies sites, procures structures, oversees community engagement. The county recruits site operators, oversees shelter operations, and ensures connections with appropriate providers. Last slide. Some considerations in thinking about an ordinance can be broken up by the type of space. So in thinking about an outdoor village type space, the city would need to set licensing requirements, establishing what would be required for an operator to apply for a license and under what conditions it would be revoked. They did this in Tacoma, for example, by authorizing the director of planning to issue permits for outdoor shelters only upon demonstration that all public health and safety considerations have been adequately addressed, and to revoke permits if the city determines the site is unfit for human habitation based on health-related concerns. Permits in other cities typically are for 1 year, and they have the option to renew based on successful operation. Specifics around licensing would need to be developed in consultation with the city's planning, development, and licensing staff. Other cities' ordinances that legalize safe outdoor spaces also typically name and define the village space, and some set operational and physical parameters. Tacoma, again, their ordinance notes that at a minimum, all sites should have a perimeter fencing, garbage services, bathrooms, electricity, portable water. Portland requires case management, housing support, first aid, and medical care. Those are the kind of parameters. Several cities require the operator to be on site whenever there are occupants and to have acceptable liability insurance, including in some cases to indemnify the landowner. The Minneapolis Health Department advised that bathrooms in any safe outdoor space should be as proximate to sleeping quarters as possible with a well-illuminated route and staff on hand. They note that poor site maintenance can cause health dangers, and they recommend requiring a backup plan in case of severe weather. Ordinances define the types of structures that are acceptable in village-type outdoor spaces, specifying tents, tiny homes, and/or portable structures, also known as prefabricated homes. If tents are considered in the Minneapolis case, the health department should be consulted on potential health implications. Some cities set out in ordinance requirements for safe outdoor spaces to be a certain distance from residents and from public transportation and potentially schools. Some cities set limitations on who can stay in the space and who can visit. Portland's safe rest villages by ordinance are only for those persons residing in high-impact encampments, for example. And finally, some cities require community engagement by ordinance. And in terms of the land and service provider, if requested, both CPED and Public Works indicated they could help identify potentially appropriate city land, given some parameters and some lead time because it's a labor-intensive activity. In regard to identifying a service provider, late last year, city staff inquired with trusted service providers about the potential for an interim indoor space / navigation center. And at the time, all of these service providers were either unable or unwilling to engage. Other cities' ordinances legalizing safe outdoor spaces are typically inclusive of safe parking, but they elaborate specifically that sleeping in a vehicle is legal when part of a safe outdoor space. Specific licensing requirements can be added for operators of safe parking spaces, such as ensuring that cars are operable, that they work. Other considerations around safe parking raised in the report include the potential for amnesty and also some practical considerations around winter months. In Duluth, they only have safe parking in the summer, and that comes with some limitations that are laid out in the report. And that concludes my presentation.
Thank you so much for that presentation. And now I'd like to recognize Councilmember Chavez has joined the committee. Are there any question or comment from council members?
Mr. Chair, I have to excuse myself. I have a 4 o'clock Zoom meeting
Okay.
with Public Works, so I apologize, but I have to leave.
Thank you, sir. Councilmember Jenkins.
Thank you, Chair Osmond, and I too have a 4:20 appointment that I have to get to, but just clarify, potentially these intentional communities could exist now if operators were willing to do it. Am I misunderstanding your report?
The maintenance code currently makes it illegal to sleep overnight in a vehicle or to have the tent structures are, so it would need to be amended to make the safe outdoor space legal.
I don't have the presentation in front of me, but I thought there was a section that churches and/or other entities could operate an intentional community.
Right. Intentional communities are, yes. Those are legal for permanent housing at the moment. So the Envision community is the example of an intentional cluster development it's underway. It's in works right now. And that's the reason I think that ordinance was put into place. So yes, it is potentially legal now under that ordinance, but there are some areas of the maintenance code that may need to be clarified further for a safe outdoor space, especially safe parking, because it's explicitly illegal to sleep overnight in a vehicle in Minneapolis.
Thank you.
Thank you, council members. I just want to remind you that we have to do a hard stop at 4:05, so we don't lose quorum. We can always bring this item for discussion, but I do want to recognize Councilmember Chavez.
Thank you, Chair Osman, and thank you to our staff for this presentation, for all the work that you all are doing, communicating with different service providers and different organizations across the country. I don't really have any questions. I just like to make a few comments of why we're pursuing these actions, but I think there's been 2 reports on this. On one of them, it noted that 85% of people living in their car in Duluth Safe Bay program regularly met with caseworkers. That is a really positive thing, that if you're able to have unhoused residents access services, and this is a really good number, I think that is something that is worth trying in Minneapolis. And then on a different report, I received that the Colorado Safe Parking Initiative, 43% of the 240 households living in vehicles served in 2023 moved on to positive housing, which included moving into permanent housing or moving in with families or friends in a permanent tenure. So those are data points that we got from PAR regarding these initiatives. I think it also talked about a potential price. The one in Duluth cost $150,000 and how they approached it. And then additionally, when it came to safe outdoor spaces, which is separate from safe parking, from March 2020 to March 2023, I believe, more than 170 people moved into permanent housing from a safe outdoor space location in Denver. Those are positive numbers. I think if we're able to establish a program like this in Minneapolis, being careful in our approach, but that is data-backed and human-centered, if we can get that many more people off the street and into permanent housing, that is something we should be trying in the city of Minneapolis. And I guess my invitation to all our colleagues in the BIS committee, because I'm not a member of this committee, is to reach out to my office, reach out to Councilmember Chowdhury, reach out to Vice President Chugtai. We will be introducing a safe parking initiative soon, which is separate from the Safe Outdoor Space ordinance. The Safe Outdoor Space ordinance component has already been introduced back in the beginning of the year. And at some point, we're going to be giving direction to our city attorney's offices to start drafting both these policies as we begin the legislative process. So that's information for all of you to know. We're open invitation to reach out to our offices before we begin that process, just so you all are involved in this process. There's also funding issues of how to fund it. That's a different conversation too, but just wanted to make those comments today.
Thank you so much, Councilmember Chavez. Councilmember Chowdhury.
Thank you, Chair Osman. I am going to hold off in asking my questions, and I will meet with you one-on-one, but I did want to say thank you for putting together both of the reports and doing the research and presenting it to us. This has been very helpful, so just wanted to give a credit to you for presenting before our committee now twice, and then our entire policy and research team. This is just really helpful in us, like, kind of looking at, okay, this is the different steps that we have to take in order to move forward on this. And I'll echo what Councilmember Chavez said. If colleagues have any questions, please reach out. Let's start having the conversations early.
All right, thank you so much. We still do have a quorum, so I want to ask clerk to file a receipt for those presentations. So thank you so much, and see no further business before us with no objection. I will declare this meeting adjourned.